What's going on? Happy Saturday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had taken a COVID test or a test for some other virus, I hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Saturday edition of the Virus Update for Saturday, October 19th, 2024. If you're new to my channel, welcome to my channel. This is where I do the Virus Update on all things COVID and any other virus that could be a health threat to you. Let's face it, health problems, viruses, they are constantly evolving. COVID constantly is forming into new variants. So we always need to be on top of what is going on with these viruses. We had a major summer wave of COVID, which many probably did not even expect because they were told, oh, wait a second, the pandemic's over. And while the pandemic is not over and COVID will always be with us, we really need to pay attention to what's going on because if you watch the news, the media, if you listen to the government, yeah, you're going to be thought to believe that everything is fine and dandy when it's not, because people still test positive for COVID, new variants still form, people are still being disabled, and weekly deaths of COVID are still over 1,000 at this time. Now, there have been other viruses which have been evolving as well, and we got to keep our eyes on that, because at any given time, a new virus could be the next big thing. That's what I do here on my channel. I keep you informed with what's going on. So if you're new to my channel, subscribe down below, give this video a thumbs up, hit that notification bell, and share this video with anyone you know. Alright, starting off in Canada today. Haven't talked about one of these in a while, but it's happening in Canada right now. A COVID outbreak declared in Collingwood Hospital's medical unit, and visitor restrictions are in place, and all patients in a unit have been tested and isolated where necessary. Yep, that's right, there is a COVID outbreak ongoing in Collingwood up in Canada. Alright, taking a look at this, this is kind of a evolving story that just continues to get worse. In California, they have added 2 more new human cases of H5N1 bird flu, taking the total this month to 13. Yeah, that's a pretty significant number, and it does suggest that the problem with H5N1 in California is continuing to get worse, and it would not surprise me if we see some cases pop up elsewhere. It does appear right now that California is the hotspot for H5N1, so we really need to be closely monitoring this situation. Alright, weekly COVID update time for Italy. We tend to get this almost every week. And here's the weekly update, 117 deaths. Yes, that is the second worst figure of the last 6 months. And you can see here, deaths have been kind of bouncing upwards, so that's not a good thing. Then we come down here to patients in the hospital, and that is at 2,355. That is the worst figure of the last 6 months, and rising figures for at least 4 weeks now. So Italy is clearly in a COVID wave at this point. And it does say here, patients in the ICU is at 86. Again, that is also the worst figure of the last 6 months. And you can see here, that has been generally, gradually rising. They had a wave in the summer. That dropped, peaked, dropped, and then it started going up again. So, yes, there is definitely a problem here. New cases, 11,432. So the good news is cases have now been starting to drop, which signals we could soon see a drop in these other indicators as well. So we can hope. The positivity rate is at 12%, and the case fatality rate is now up to 1%. So this is not good to see what's going on over in Italy. The only good news is that cases are coming down a little bit, but everything else right now is going up. And again, they added another 117 deaths. Alright, wastewater scan for the United States. Let's go through their update here and see what they say in their thread. COVID-19 nationwide SARS-CoV-2 is in the medium category nationally, with medium concentrations and a downward trend over the last 3 weeks. Notably, the South and the West are now in the low category. That is some really good news. COVID-19 variants in sequencing data from a subset of wastewater scan sites, we see that the KP family is making up 48% of the variants. KP.1, which is lime green on this chart, at 3.3%, KP.2, stale blue, at 12.2%, and KP.3, light blue, at 32.7%. Sequencing data has a lag of 1 to 2 weeks after collection. RSV nationally and in all regions, RSV is in the low category and not in seasonal onset. However, the rate of detection has increased modestly in the last couple of weeks, especially in the South. Yeah, I've been noticing that myself, where RSV is increasing in the South. Influenza, flu A and B is in the low category nationally and in all regions. That is good to report. H5 influenza marker has been detected in 9 states at this time, and those 9 states are Arizona, California, Colorado, Iowa, Idaho, Minnesota, Michigan, South Dakota, and Texas. Moving on now to the EVD68, and EVD68 is now being monitored as a seasonally detected pathogen. It is in the high category nationwide and in all regions except the Midwest. In the last 10 days, it was detected in approximately 75% of samples tested. Norovirus at this time is in the medium category with no trend over the last 3 weeks and a medium concentration. Alrighty, moving on to some of our things that we look at every day. And first off, pollen levels. The National Allergy Map shows there is some orange in Florida, some orange in Texas, some yellow in the south as well. The northern states are not doing bad right now. You can see a lot of green here. 30% of the country is in the low to medium status. Taking a look at what's going on with air qualities, and you'll see there are a few troubled spots, and I think that's going to remain the case for the foreseeable future. We're going to see a lot of above average temperatures across a large portion of the country over the next week or so. And with that, there could be the potential for some bad air qualities, and there already are some bad air qualities. You can see across portions of Kansas, Nebraska, Minnesota, air quality is not great. The wildfire issue exists in the West Coast, and really that wildfire issue could pop up at any time, anywhere, because so much of the United States, aside from the Southeast, where the hurricanes hit, is very dry, so we have to keep an eye on that. And anytime you get wildfires that just pop up, well, suddenly you're looking at air quality problems. Want to learn more what's going on with the climate and weather? You can do that in a few places. You can go over to my X account, Climate Data Report, also Blue Sky, and you can also go over to my Climate Data Report over on YouTube, where I did just post a video today on what I expect with the above average temperatures and a look at newly formed Hurricane Oscar in the Atlantic. Alrighty, moving on. Philadelphia had 871 EMS calls on Friday. That is a really high number. That's not good whatsoever. Let's do a live look in at what's going on in the surrounding areas. And we can see right now there are quite a few calls in Montgomery County. 12 calls, which is high for Saturday. But I do note here, 1, 2, 3, 4, 5 of them are for vehicle accidents. And hey, this is a good time for me to remind you that COVID era has led to an increase in accidents. There have actually been studies conducted on this saying, hey, accidents are up. Let's take a look at what is going on in Chester County, Pennsylvania. And wow, really busy in Chester County, Pennsylvania right now. I'm seeing not 1, not 2, not 3, but 4 respiratory difficulty calls, 2 stroke calls. I'm seeing a sick person call, EMS standby. That's just usually a standby for an event, and a bunch of other things. So again, really busy in Chester County, Pennsylvania at this time, which is never a good thing to see. Alright, moving on to my notes for today. I do have a couple things that I want to show you first. And first off, I want to, well, not show you, but tell you about, and that is Halloween parties. It's getting to be that time of year. Let's go back to the browser. Here's a tweet that I did earlier today, well, a thread, and the weekends leading up to Halloween mean big parties. I can recall in the pre-COVID times, the Uber map for rides on weekends in the second half of October was lit up like crazy, and this is very true at nighttime. I'll keep an eye on the Uber map tonight, but guess what? I do not pick up passengers on the Uber or Lyft app anymore. No, no, no. It's too risky to do that. And now that we are in the COVID times, we really have to be mindful of what's going to happen over these next few weekends. Right now, we're seeing cases continue to drop nationally. I'm going to show you a chart in just a moment. We're continuing to see cases drop nationally, but with how crazy things could get over the next couple of weekends and even Halloween week itself, I think we are going to see that drop either slow down or completely stall, just because there's going to be increased transmission. And let me continue on here. Next weekend will likely be the big weekend for parties. If you plan to have one, please take all necessary precautions. Many people who have had COVID, that should not say not at high risk, many people who have had COVID are now at high risk of illness with other respiratory viruses or even reinfection of COVID. And here's another thing to consider. Before COVID, as I stated, I would drive people around on Uber and Lyft. Halloween is a Thursday this year. What happens on Thursday? That's the night the college students go out and party and go out to bars, so that could also represent some COVID transmission. However, let's take a look at what's currently happening. And you can see here, this map here from Jay Wyland shows here that COVID transmission continues to drop at this time. But if we pay attention to the end of this chart, the very end, we can see that drop, while it's still happening, it's starting to slow down just a little bit. And we can see here, all the other times it has slowed down like that, you see, we've done many of these COVID waves. It's been a long pandemic. See, each time it has slowed down, that usually represents that we're getting close to a stall. Then eventually things start turning around and going back up. So it's not that far away. And post-Halloween could be what gets the holiday wave going. We'll just have to wait and see how things play out. Or we see a little bit of an upward trend after Halloween. Then we stall and drop before then eventually going up once again. Something is going to happen along those lines. And will it happen after Halloween? Will it be a little later? Only time will tell. All right, going back. Now some data from CJS 83172. Daily weekday reporting states. Florida had 443 new cases and 37 new deaths, and 3,017 cases and 88 deaths reported over the past 7 days. New Jersey, 211 new cases today and 2,144 cases and 2 state-reported deaths this week. New York, 792 new cases today and 4,563 cases for the week, to go along with 43 new deaths. Puerto Rico, which never reported over 90 new cases on any day this week, had 507 cases and 4 deaths this week. Weekly reporting states: Alabama, Mississippi, South Carolina, 12 new CDC reported deaths for each state. California, 2,849 new positive tests and 102 new deaths. Idaho, 251 new emergency department visits. Illinois, 34 new deaths. Louisiana, 680 new emergency department visits. Missouri, 22 new CDC reported deaths. Montana, 492 new cases and 3 CDC reported deaths. North Dakota, 284 new cases and 2 CDC reported deaths. New Hampshire, 7 CDC reported deaths. Pennsylvania, I'm not happy with what's going on in my state. 48 new deaths. That's a high number of deaths for my state. Texas, 1,564 new cases and 40 new state-reported deaths. Wisconsin this week, 860 new positive tests and 13 CDC reported COVID deaths. And West Virginia, 791 new positive tests and 2 CDC reported deaths. Alrighty, taking a look now at what's going on with Canada and the viral levels there. The viral activity level of COVID-19 is moderate. The viral activity level for flu A is low, not detected for flu B, and the viral activity level of RSV is moderate at this time. And remember, they just had Thanksgiving up in Canada recently, so that could start to play a factor into things rising up there, especially for COVID being moderate. Now, let's take a look at some wastewater data, shall we? And we'll take a look at a couple sites. Let me just refresh this and see what we come up with. And you will notice here that, for the most part, nationwide, COVID continues to drop. It's a steady drop on wastewater scan. We're also seeing RSV is, overall starting to trend higher. It did come back down a little bit, but overall it's starting to trend higher. Influenza A is low, and we're at very, very low levels of influenza B. It has gone up ever so slightly. HMPV is low at this time. Norovirus, it is listed here at high at this time. Let's take a look at a couple individual sites, and I think we'll take a look at New Jersey today. Let's see what's going on in Newark, New Jersey, and we do note that things overall have been dropping. Most recent update was up slightly, but I'm not terribly concerned about that. Starting to see influenza A rise a little bit. Influenza B, not much of an issue. Still low for norovirus and Mpox. There was a detection of Mpox recently back on October 10th. Now let's go out to somewhere on the West Coast, and how about we check out Las Vegas, Nevada, and see what's going on there. And take a look at this. COVID levels are back to medium, and they are starting to rise once again. So that's something we have to concern ourselves with. RSV, low. Influenza A is rising at this time, and it is pretty well visible here. Still low, though, at this point. Influenza B is low. And norovirus, wow, norovirus has had a big rise this October. Looks like that has peaked and is dropping somewhat. It is listed as high at this time. Mpox is not an issue at this time. Let's go down to somewhere in the south and see what's going on there. And how about we go down to New Orleans and see what's going on there? And we do note that COVID is very low at this time. RSV is low, influenza A, influenza B, HMPV, all low, medium for norovirus, and that is dropping at this time. And we can see here, hepatitis A, haven't been any detections of that since August. Alright, going over to Florida now, and how about we see what's going on in Tallahassee, Florida. And in Tallahassee, we do see that things are rising somewhat at this time for COVID. Not a big rise, but just a small rise at this time. RSV, influenza A, influenza B, HMPV, all low at this time. Norovirus is low at this time. And now let's go up to the Great Lakes, shall we? Let's see what's going on there. How about we go to Warren, Michigan, which is a fairly big wastewater, so 140,000 population, and wow, look at this. This is really interesting. The wastewater for COVID has actually been going upward, and it is listed at high. And I mean, these are really high levels of COVID, especially for a wastewater site with 140,000 population. That is something we're going to have to keep an eye on. Matter of fact, I'm going to do a tweet on that in just a little bit and post on Blue Sky as well. RSV is low, influenza A is low, influenza B is low, norovirus is medium at this time, and we can see hepatitis A is not being detected now. It was well over about a month ago. Alright, taking a look at some new CDC data, we can see here epidemic trends are likely declining, or not changing for a majority of the United States, except for a few places that did not update, such as Missouri and Wisconsin, and it looks like Wyoming. No, Wyoming, no. I don't know. Is that changed or not changed? I think that is not changing at this time. Moving on now to, this is not new data. We'll get an update on this next week. This is the latest variant for COVID, which is the KP 3.1 variant, which is at 57.2% at this time. And taking a look at those emergency department visits, and let me refresh just to make sure that is correct. And it is. And you can see here, though they continue to drop, you can clearly see in the blue, that drop is starting to stall. It is starting to slow down. So pretty soon, I think we're going to see that reversal at some point over the next several weeks, or maybe within the next month or so. Taking a look at what's going on with influenza, most places are in the minimal category at this time. We do see Washington, D.C. is listed at low at this time. Alrighty, folks, that does it for the Saturday virus update. Our next virus update, I don't think we're going to have one tomorrow, but who knows? If I find a whole bunch of stuff this evening, we'll have a virus update tomorrow. If not, we'll probably have one on Monday. If you're new to my channel, subscribe down below. If you like this video, give it a thumbs up, hit that notification bell, share this video with anyone you know, and leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Saturday afternoon. Thanks for watching.